listening to the Pharmacy Podcast Network.
Something I pride the Pharmacy Podcast Network on is bringing to our markets, bringing to our listeners new innovations, not only in what is the role of the pharmacist, how is it evolving, but my sweet spot where I started from was technology, and specifically pharmacy management systems for long-term care pharmacy. Jettison into the future, remember all of the consulting applications that came out to help pharmacists manage those types of conditions that a consultant pharmacist needed to be able to put in the information, access information, and then turn around and be able to make decisions and solutions and sharing that information with physicians. I'm excited today. Our PH Ally, a partner of the Pharmacy Podcast Network since its inception and beginning, the one and only Dr. Sean Bajornal is here with us. Sean, always saying your last name incorrectly. Bjorndal.
The Viking in me is screaming, but it's okay, Todd. It's like Baby Bjorn. You can say that nice and easy, right? But you put a DAL after that. It's like
Bjorndal.
Yeah. Anyways, it's all good. Hey, but all right. Oh no, thank you, Todd. Thank you for the platform. Always love talking to you and just all the work you do for all of us pharmacists and in the pharmacy world and the technicians as well. So love your partnership and love your enthusiasm to make it all go and be better. I want to introduce Jessica Lunsoff. She created Tamvoes. I'm gonna let her speak to that, but it's something that we thought Asha and Kevin and I have been working with Jessica now for months, and it was something we saw a valuable partnership that we could bring to pharmacists that in the consulting pathways that would be like, okay, we need to make it easier for pharmacists to do this if we want pharmacists to get out into this space. So with that said, Todd, I'm going to kick it back to you to kind of kick us off for the podcast.
Well, yeah, and I also want to say thank you to Kevin for being here too. Kevin Walker, the one and only. Welcome to the show, and this is something that's going to be reoccurring. So, co-host, host, who knows what Kevin's going to be doing, but you're always welcome here, and your insights are amazing, and you bring a new inspiration to our PH Ally. So, thanks for being here, Kevin.
Hey, no, totally appreciate you, buddy. Sorry, my voice is sounding not as beautiful as it usually does, but dealing with a little bit of a cold here, but really excited. Jess and I, we hit it off very quickly, just getting to know her and kind of her entire story behind Tamvoes, her having her nursing background and me in the hospital setting and the long-term care setting. We just had a lot of commonalities that we hit across, everything from transitional care medicine to some of the lack of patient care and advocacy inside of healthcare. And the things that she's created with her team is just really exceptional, not only for the pharmacy world and healthcare, but also for patients to be able to own their own healthcare records, their own ability to take care of themselves and their families. And it's something very personally special to me, not only because I really believe in everything that Jess and her team are doing, but also because I've lived through those exact same moments like every healthcare provider has and every person has, the frustrations that we've hit when it comes to dealing with our current healthcare system. So really excited to have Jess on here with us and her to tell us a little more about her story. But thanks so much, Todd, for having us. Really appreciate you.
Absolutely. Jess, we keep talking about you and you're sitting there quietly, and we thank you for your patience and what you've done. And this is an entry into consultant pharmacy. And let me tell you what, it's going to explode in 2023 and beyond. I cannot wait. 305,000 active pharmacists in the United States, not even mentioning Canada and other parts of the world. And I guarantee there's going to be 10, if not 20% of them who are going to become consultant pharmacists in the future. So let's talk about you, Jess. Let's hear a little bit on your background as well as the platform that you've developed.
Absolutely. Well, it's really great to be here today. And Kevin, Sean, it's been a pleasure getting to know you guys. I have not met you, but I've definitely felt your energy from a distance, and the change that pharmacists are making and you guys are spearheading that is just phenomenal. And Todd, it's really nice, you know, to see what you're doing as well and to meet you here today. So yeah, I'll get into a little bit about the story. The story is kind of a good one, but a difficult one in the December season, just because of what had gone on in my history to what led me to build Tamvoes. And the name is actually where it all came from. And I want to shout out to two lovely ladies that have since passed on from cancer, but they were my grandma and my mom. So Tina Tamming and Yvonne DeVoost. And when you take those two pieces of their last name, you put it together to create Tamvoes. And Tamvoes is ultimately really about connecting all the pieces and connecting and care coordination and, really looking at the big picture of somebody's healthcare outcomes as opposed to just the silos and fragments and the different ways that it goes. So that's ultimately why Tamvoes was made, but it goes deeper than that. I mean, I was very, 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 very close to my mom and my grandma, and I do have a nursing background. I worked as a nurse for multiple years in an emerge setting. I worked as a home care nurse. I worked as a long-term care facility nurse. When you talk about long-term care, Todd, it resonates with me. I mean, I decided that I never, ever wanted to be a long-term care nurse again when I worked long-term care, because you didn't have the time to spend with the seniors. You didn't have the time to, really give them the dignity that was required while they were in their last stages of aging. But when my mom got diagnosed with cancer, and it was around Christmas time in 2016, she got diagnosed in the emerge. Since that day, she moved in with me, and she had stage 4 multiple myeloma, which, if anybody knows anything about multiple myeloma, has multiple comorbidities within it. It's a blood cancer that's deep within your bone marrow. It's very difficult to treat. And she ended up having a mutating multiple myeloma that decided to rear its ugly head every year around Christmas for 3 years after that. And we did everything we did every clinical trial. We tried every pharmaceutical. She would get better. She had bone marrow transplant, and it would just come back. And unfortunately, she passed away January 1st of 2020. But during that period of time, I really, it was such an eye-opener to see how fragmented our system is, how taxing it is on a caregiver and the patient especially to repeat their sad story over and over again, to have in access to their health information, to be going to different hospitals and nobody's communicating. And there's just so many errors that were being made. And it turned out that me as a caregiver, which ultimately I would say I'm pretty expert in the healthcare industry, was struggling to manage all this on, not on my own. We had lots of family members, but it was just a really stressful period of time. So during that time of the caring, I figured there's got to be something better. And I went into some really simple technology fixes that I thought would just make somebody's life easy. And to be honest, I don't ever admit to being good at technology. Technology is kind of something that was foreign to me. And if you ask my kids, I shouldn't touch a computer or any type of handheld device. But I thought, you know what, it's the way the world is going, and I had to figure it out. So I started drawing it on a napkin and saying, what would make it better? What are the easy, simplest pieces for a caregiver and a patient to have in order to, have a better healthcare outcome? So it's really kind of a heartfelt story that why Tamvoes was made, and I could probably go on for multiple hours about the inefficiencies in healthcare and the need for solutions to look at the big picture as opposed to just the little picture. But yeah, that's why I built it.
I think the beginnings of the organization and the the tie back to even pharmacy school with your partner Stacy is special. And I think that your understanding of care at the bedside is also extremely special and meaningful to the build out of this platform. So in a verbalizing rather than being that this is a podcast, kind of give the pharmacist out there listening right now an idea of what this system is intended to do to pull everything together so the pharmacist has it at their fingertip, but then in charting and or documenting, they're able to assure that they're capturing the information that's necessary in consultancy, as well as your vision to tie this into other systems. Share that with our listeners as well.
Yeah, for sure. So I think our patient platform is built on 4 pillars of health, we call them, which ties into the professional platform, which the pharmacist would be using for their consultant practice. And it's a very secure, and when I talk about security, we have taken security into utmost importance. So we house our information through a HIPAA and PHIPAA secure cloud, and also even the transfer of information is secure. So that's one thing that is quite the worry out there. Who's going to get my information, especially if it's all in one spot? So we are secure, and on that you can share vital information, such as the biggest information for patients to be sending to clinicians is, how are you feeling? What are you doing today? What have you ate? What are your vital signs? And also then the next step, and that's what we call My Journal. And that's a feature that you can share that information at the click of a button securely with people on your team. But then we took it to the next step, and we took it to where can you hold all of your secure documents? Secure documents are so many different things. You're talking about lab reports, you're talking about pharmaceutical reports, you're talking about x-rays, you name it. Where can we hold this all securely, and where can we share this securely? So we call that our personal data trust. And we also are integrating with existing electronic health record systems so that that information can seamlessly go in, so you don't have to retrieve it or request it. And then the pharmacist can actually just get all that information in one spot and basically be able to see the whole picture and share it with other potential vendors as well. The other one is My Health Profile, and this one's really near and dear to my heart. And I don't know why it just doesn't seem like rocket science, but My Health Profile is where you can put all your health questionnaire in one spot, and you can actually seamlessly share that to multiple people at once. You don't have to repeat your story over and over again, because so many people ask the same questions over. And why can't we just have that shared and be having other professionals add to it when things are changing? So that point of entry doesn't have to be by the patient. So it could be from other people in your healthcare team, and that can be building that, those simple 4 pillars of health that evidently empowers that patient with their health information, and that gives them control to share it, which I think from a clinician standpoint, if you focus on that individual and you are empowering them and educating them, then, tenfold, they're going to want to work with you, because I've seen it in a lot of the professionals that we work with. Clients are satisfied when they feel empowered.
So when I'm listening to Jess, I'm thinking of the pharmacist out there who does want to dig in to their patients' needs that have hypertension or diabetes, or they're just starting a new cancer medication, and that pharmacist has an opportunity to say to the patient, hey, I'm going to be able to help you navigate your condition and even improve the way that you feel every day, based on things that pharmacists just understand about medication interactions, as well as your diet, as well as, becoming a healthcare coach beyond just a pharmacist or the traditional thought of what a pharmacist is. So how does the pharmacist plug into this system specifically, knowing that, even in the United States, for example, we have so many suffering with chronic conditions? Kind of give our pharmacists listening how this system could become something that they use every day in their own practice.
So yeah, each pharmacist would create basically a management tool that they could use for their clients, and they would all have their patients listed there. And then they would send over to their patients a login that they would log in and start being able to share securely information back and forth. So it would be a client management tool that inevitably gives the client the information, and vice versa will give the pharmacist the information. For instance, when you were just speaking about, looking at the whole picture, I know Kevin and I go back into our, geriatricians. I mean, they're one of the people that need to see the whole picture of a senior. When you can take that to a pharmaceutical level, and you can see, because they're on 30 different pills and they're having all these symptoms, and their family is complaining about this, and the PSWs are complaining about this, like that's where the pharmacist can use this tool to really evaluate that and take a deep look in as to what's going on with the patient.
I like the network too. The dietitian that's out there, the therapist that's out there, someone that is in rehabilitation. Maybe there was a fall involved, so now the senior is on a short-term medication to battle inflammation or something. Regardless, there's that team environment that you can, by authorization and by security, open up the information to another care provider, including, like you were saying, family, people that were deemed secure per se. Does this live on the cloud, for example, from an infrastructure perspective? And then also talk to us about integration with other systems, like a Medispan database that we have access to medications, like right now today in the development of the system. Tell me how that all works together.
Mm-hmm. Well, the integrations has always been something I've been making sure we had in the roadmap, because manual entry is something that is time consuming and also is foreign for patients or caregivers to do. It's evidently that we don't want to have to do that. We want it to manually be done for us. So over the last year and a half, I've been building with a team an integration hub or an integration umbrella. So now that we've built it, we can actually seamlessly integrate with existing systems that have allowed us to. And with the new, fire regulations, which that term I don't even really know myself, but supposedly you can easily integrate with, the Epics or, the Cerners or the point click cares, which we have integrated with point click care, and we're on the route to Cerner. And it's difficult because there's a ton of record systems out there, but we want to figure out which ones would be the top 10 that we want to integrate with first. So to be honest, if somebody comes to us and says, this is a platform we need information from, we can easily hook up to their APIs or connect into that information will just flow in securely.
Now talk to us about the aspect of the time allotted to each patient that the pharmacist is working with. And we have differences of health system between Canada and the United States, for example. But if there's a consult taking place, are you helping a pharmacist to understand their time management in a 15-minute increment or a 30-minute review or a 60-minute review, whatever that is, in order for them to start thinking about, now, how do I bill my time so I know what I'm documenting, what I'm sharing, collaboration with someone else, for example, and that continues to be part of the specifics around that patient's life and that where that patient is living within Tamvoes. So talk to our listeners about that aspect of consultancy too.
So there is differences in the Canadian and US healthcare industry. We work off of, in Ontario, OHIP. So where I see the value and where I've seen it actually happen is that a patient can send the information prior to, a physician appointment or a pharmacist appointment, so they can review it. And maybe Sean or Kevin, you can touch base on this afterwards, but the value that it has up here in the north is that appointments that typically would take an hour and a half for the patient to repeat their story and go over things over and over again are now taking 20 minutes, which if it's a fee for service, that might be a different case. But ultimately, I've built this for the patient. So a patient to be more satisfied with less repetition and so forth is a client that's going to come back more often. So here in Canada, we've seen the value of efficiencies within the healthcare system of having this information on hand. But maybe Sean, you or Kevin, if you're feeling up to it, want to help out with this one?
Yeah, of course. No, I think it's a really good question, Todd, and it's rather applicable right now with a lot of things happening in both RPM and RTM codes and CPT codes in general. We're seeing more and more kind of pressure from potentially CMS and incident to billing coming back to us to measure our time and validate our time in some way, shape, or form. And there's a lot of great software companies out there that are doing medical or pharmacy billing, related things, which I appreciate. And, some of them are really close friends. So the one thing that I think is a differentiator, though, what Jess is putting together and why we partnered here is really on the basis of that consultancy is really faced, as Jess mentions, back at the patient. So even though inside of the documentation elements that the team has built inside of Tamvoes, you can record different elements of the care that you're providing and have a written record of what you're doing, which can include time. The entire point of the Tamvoes platform for the pharmacist team or for the patient is to consolidate all that information into one place, one easy access point. So when I think of use cases, Todd, and then Jess and Sean, please tell me if you guys have more, but in my mind, I'm thinking back when I was in the ER and I had a patient coming in and I had no idea what they were on. I had zero ideas what medications they were on. I don't know what their med history was. I am flying blind, hoping to be able to find some things and make enough phone calls to be able to do what I really want to do for this patient, right? And they could have something like this that gave me all that information in one place. Or it could be at the community pharmacy. And I'm thinking, I wish I had those labs. Well, guess what? Every community pharmacy in this nation wishes they had those labs. And now there's a way for you to be able to have those labs from a really easy, convenient source. And your patients can feel empowered by it because they own it. I feel like those are the real locations that, the benefit can be had. And inside of those circumstances, even talking about billables, which, to me is just part of the conversation, that we have to have. I think, especially in modern independent healthcare, MTM services and the things that are currently happening in multiple states, especially when we're looking at services that are happening at the Medicaid level, as opposed to the Medicare or CMS levels that are controlled by the states. You're seeing higher levels of reimbursement for some of these services that necessitate you to gather records from patients. What better way to gather those records from patients than have it all in one spot? Easy for you to be able to review, easy for you to be able to collate. You can then go back and forth with that patient saying, Mrs. Jones or, Mr. Stevens, we noticed that you said your OTC was this, but you're actually taking this, and making sure those are correct records, because that is a real difficulty in every level of care, from transitional med practice, is going from one acute care center to a rehab center back to home, and hoping and praying that there is some way to navigate that system without hurting the person even worse than they came into the initial acute care visit with. And I think one thing that has to happen, Todd, and just seeing your faces telling me this is true, you have to have some kind of piece of information that can be held with that individual throughout the entire journey. And I feel like that's been missing for far too long. And we've been trying to patch it together with one system's patient portal or another system's patient portal. But guess what? Then they go to another system or they see another group. None of that's connected, and they don't have any ownership. And I think that's the key.
Absolutely. And the reason why you saw, and obviously listeners can't see my facial expressions when I'm smiling, but the reason why I got so excited to interview you, Jess, was under your Tamvoes website, there's the team section, and building that team includes the family, the friends, the healthcare professionals. And you mentioned family and friends before even the HCPs. And I applauded you. And the reason is I think of my friend and one of the biggest podcasters in healthcare, Matthew Zachary, who has Off Script Media, and he was a cancer patient, and he's a survivor when he was very young, and up through his early 20s, and he beat it. And he said the healthcare system sucked. He hated it. He swears a lot. He uses the F word. He has you have to listen to his podcast. He's amazing. But now he's a patient advocacy champion, and I should say warrior, because he has a sword and he fights for patients and double checks insurance companies and strange systems that hold back healthcare from happening. Your system involves people that aren't normally involved in healthcare, which is the family and the friends and the people who understand what the patient is feeling and going through. And they get to feel like they're part of it, which they are part of it. And now this is included in the readouts or the notes that the pharmacist or the physician or the nurse can read up on, and understanding health for the patient from another perspective, which really gives you a much more holistic global view of that patient, rather than it being all about a CPT code or a double check code or some kind of billing code, which is very cold, and it makes things much more transactional rather than value-based care, which is what we're moving towards, instead of transactional care, which is what we're still part of. It's still tied to the prescription. The pharmacist pay is all about that dispensing. And that's not what a PharmD is. It's about, really unraveling the complexity of what a patient is going through in the specific treatment that they're going through. So this system is encapsulating some of the team members of the team for healthcare that weren't included. So I applaud you, Jess, for that.
Yeah, that's you said it right on. It's the family, it's the people that are gonna get them out of that healthcare event, like so many times when somebody's going through a cancer, and I'm glad he is advocating now with that sword, because we need more of those. But it's too often that they're just so engulfed in the depression of being sick, and the people in their healthcare circle that are the clinicians that's all they talk about with them, right? So they need to have those friends that, they're not having to repeat that story from that clinician to their friends and family, because now they're in the same circle of depression, of this consistent cycle. But if it can be sent to them prior to them having tea or going out for dinner, so it's not the main focus of conversation, so they can actually talk about, the sports or something that is not their cancer, would be a much better dinner time, as opposed to what is happening when it's just, engulfed in sickness.
Accessing the information specific to the patient is going to be extremely important to a consultant pharmacist out, either in the home or at the bedside, or nursing home, assisted living center, even a healthcare center in the community. So when I think of what Kevin was sharing with regards to lab collection, is this a PDF that is attached to the record? Is it an API that's looking to the EHR system that's pulling in information? Talk to us about the aspect of collecting data that goes beyond the family members and friends that are kind of chiming in, but also the black and white side of this system of what's being collected, how it's being collected, and then how a consultant pharmacist can access it later.
So through the integration, there'll be different fields that information can go automatically into. And that could be, lab report, that could be imaging report, that could be a health history. And then from there, it can actually be compiled and put into their health profile. So through the machine learning, we'll get it into the spots that is necessary. That's one way through the integrations. The other way is by simple attachments. So in the personal data trust, there is attachments. So a document you can save as a PDF. And then, that consultant pharmacist can actually share that with the patient very easily and securely. So the patient has it in their profile if they would want to. But it's a very easy log on once the pharmacist is set up, and then they can start communicating with their patient or other people on that clinical team that you've added to the team.
Excellent. So what's exciting is that you're plugged into the growth of RPH Ally and the network that they've put together. We have specialties in this network that focus on pediatrician interaction, senior care, our community pharmacist. Obviously, this falls in line with the technology to empower our pharmacists, especially the coming of this consultant role. When I say consultant pharmacist today in the United States, the very first thing that our listeners are thinking of right now is the long-term care pharmacist. And that's not what I'm talking. I mean, that's a part of it, but the consultant pharmacist of my future of what is pharmacy is that pharmacist who can walk into the home of a patient that is a patient of ABC Community Pharmacy, and the consultant pharmacist gets to actually sit down with the patient and or with the family members too, and really collect information that's very apparent and very important to the condition, including seeing the environment that this person is living in. And that's where home care kind of comes into this too, which in the network and Pharmacy Podcast Network, we have a whole home care segment that's talking about the expansion of community pharmacy and the world of home care, which is not necessarily clinical. It's about making meals for them, or making sure that there's some light cleaning, or just walking in and knowing, hey, our remote patient monitoring technology is amazing. But every once in a while, you got to get somebody in someone's home and environment to look at them in the eyes and ask them how they're doing. And that's a whole part of healthcare that kind of gets lost. And this application, this program pulls that personalization back into it because of how you've expected other people, part of this patient's life, to chime in and to document what's happening in that patient's life. Tell me about integrations that you're working on so we can get excited about the future. You don't have to be specific about the systems per se, but for example, I'm a veteran pharmacy management system sales guy and business development guy. So all of my first 8 years of pharmacy was all about the software side of pharmacy. And I'm thinking of integrations with community pharmacy systems. I'm thinking of, integrations with libraries that pull clinical information, and of course, the billing side. But share with our listeners kind of the future roadmap of some of your integration ideas.
I think our point-click care is one of the top management systems used in long-term care in North America, and they've done a really amazing job of really, coordinating the electronic health record system of the seniors. And that integration has allowed us to, in the patient portal, have access to all that information, and that flows right into somebody that is a POA or a caregiver, or somebody that's living in long-term care. As we know, they're very overworked, and it's difficult for people of that senior to get information. So through security and allowances, we can get that seamlessly sent over to the caregivers. That's one that has been released. So we're going to be launching that in the United States with different long-term care facilities, which will include having access to all the pharmaceuticals and, care plans and so forth. The next one is we aren't looking at doing an integration right now with what we are looking at is building a scannable tool that pharmacists can actually just scan up the document that lists all their medications and have that completely built into a medication list that is secure on the platform. There's too many times you walk into a patient's home, and how many times do they say, can I see your list of medication? And they go, to their, fridge and find it. That's where they securely were told to keep it, just in case they went to the emerge. And then you can take that piece of paper and have it just uploaded very efficiently into your system, and then be able to share that and do studies on it. We've also taken what's called the medical search. So I love to do research and see trends and being up to date with the most relevant medical information. So if you type in, what's the interaction with a certain pharmaceutical, it'll go into the most relevant free PubMed articles and come up with a list of the top 10, and you can do some research right on your system with that. The future roadmap will be providing more people on the professional team, and the pharmacists can actually have vendors that they're connecting with and getting information. So it's really creating that professional team atmosphere, and then ultimately sharing the information with the patient or client.
Well, I tell you what, Sean, you brought a interesting interview to the Pharmacy Podcast, and appreciate that with Tamvoes and what the future holds. What are your ideas, Sean, for the platform, especially when we have champions like Dr. Jamie Wilkie out there, who's just, teaching hundreds of pharmacists how to build their own businesses. So what are your ideas for this platform?
Are you talking overall RPHLA, or are you talking for the Tamvoes RPHLA product launch?
No, more about the partnership with RPHLA and pushing it out to specific sectors of pharmacy care.
Well, this is a perfect example of, this Tamvoes relationship. We want to do this over and over again, because this product with Tamvoes is what Jamie's consultants need, right? This is perfect. Like, they've already done the studies. They want to get into consulting with PGX, and now it's like, bam, here's what you need to take that to the next level, right? I'm going to plug our PHLI here because we have the Pharm BA. So if you haven't done the studies and you want to get into consulting but have no idea where to start, we probably don't want to start with a platform. You probably want to start with a Pharm BA to get that knowledge, and then you come back and you grab the software and you go, right? But yeah, I have no idea to answer that. I'm just really glad Kevin was able to struggle through his cold today to come on and talk about the software. So thank you, Kevin, for joining. And I want to add to that was the first time I've heard Jess's story, right? And I missed the first couple meetings months ago with her team. But fascinating. I got a little bit of it last week when Kevin and I were preparing for the podcast. I didn't even know the backstory behind the Tamvoes name. Love it, Jess. Love it. Great story. Thank you for sharing that. But yeah, Todd, to answer your question, it's really about collaborating with everybody. Like, we want to collaborate with anybody that's pro pharmacy and wants to do good by the profession. I'm really glad this conversation was really led from the patient, right? We launched Andrea Leshak's channel here a few weeks ago, the patient advocacy channel. And that, this is it's dead on what pharmacists need. What pharmacists stand for is taking care of that patient, and to now turn it around and have the conversation and this whole platform actually be built for the patient I think it's fascinating.
Absolutely. Well, this will not be the last time you hear about this platform, because we're going to have pharmacists come on in the future, sometime in 2023, and talk to us about the usage and best case usage for Tamvoes. And I think, Jess, you're going to learn a lot from your user, and your user will probably come back to you and say, here's how we build treatment protocols, and here's how we build the planning, and here's how we built, integration into a pharmacy management system or whatever it is. But if there's a developer's kit on the backside of this, don't be surprised if he has some pharmacists who are extra nerdy, and they're also programmers on the side too. So this is exciting, though. This is something that, like Sean was saying, that we need and we're ready for, because There are a bucket load of pharmacists out there ready to build their private consultancy for patients that they know in their own communities, and they want the ability to document. And we all know that if you can't properly document and be able to add in other vitals and other people's information that are part of the healthcare team, it's hard to scale it. It's number one, it's hard to scale it. Number two, it's hard to get paid for it. So we're looking forward to hearing more about Tamvoes, and really appreciate you, Jess, coming on the Pharmacy Podcast and talking with us.
Yeah, absolutely. Thanks, Todd. And I'm just really want to say shout out to all the pharmacists out there that are, taking that next step and really focusing on the consultancy and looking for tools to better their patients holistically. And I want to thank Sean and Kevin for, building the relationship. It's always about relationship building. And if we want to take over the world, we have to have strong relationships. And Kevin, I hope you feel better, because we can't do that when you're not feeling well. And yeah, thanks again for having me. And I look forward to the next time.
Thank you. Thank you, Kevin. Thank you, Sean. Double shout out to Kevin's family, and hope you are feeling better during this holiday season. It's not fun to be in the holidays when you aren't feeling well. So definitely get better.
Oh, thanks, buddy. No, appreciate all of you guys on this chat today. I'm just really excited for the rest of 2022 and a very exciting 2023. So once again, thank you guys so much. We'll be talking really soon.
Agreed. Hey, take a look at rphlally.com, rphlally.com. If you're not signed up for that, it is a safe space to be in the pharmacy profession. It doesn't have the anger that the Reddit the chats have, which I always go to RPHLA to feel better about our profession in comparison to some of the public boards that are out there. But once again, if you're not part of the RPHLA movement, please join up. You're an important part of the future of pharmacy as a pharmacist and as a pharmacy professional. A shout out to you, Sean, for starting the platform and how far it's come. And how excited I am about what's about to happen in 2023. So thank you so much for listening. Please share this podcast with a fellow pharmacist who wants to build their own consultancy. Let them know about Tamvoes. And the information to get more on this will be in the show notes, and will all obviously be on the rphlally.com website. And with that, we thank you for listening.